Artificial intelligence is revolutionizing healthcare at an unprecedented pace. From diagnosing diseases to drug discovery, AI promises to save millions of lives and reduce human suffering. But beneath this transformative potential lies a darker reality that the healthcare industry is only beginning to confront. Today, we'll explore the 5 most dangerous qualities of AI in healthcare, risks that could undermine patient safety, deepen health inequalities, and fundamentally alter the doctor-patient relationship in ways we're not prepared for. Imagine you're a doctor, and an AI system tells you that your patient has a 90% chance of developing heart disease within 5 years. You want to understand why, but the AI can't tell you. This is the black box problem, and it's AI's first dangerous quality in healthcare. Modern AI systems, particularly deep learning models, make decisions through millions of interconnected calculations that even their creators cannot fully explain. When an AI misdiagnoses a rare cancer or recommends the wrong treatment, we often have no way to understand what went wrong. In 2019, researchers discovered that a widely used AI diagnostic tool was making decisions based on irrelevant factors in medical images, like the type of scanner used, rather than actual medical indicators. The system appeared highly accurate in testing, but was fundamentally flawed. This lack of transparency creates a dangerous precedent.